Good evening, ladies and gentlemen. Welcome back to our special broadcast. I am your host, Ryan Hampton, and I'll be taking you on a course tonight over what is called MRSA. Many of you may have not heard of MRSA, but what MRSA is the methicillin-resistant Staphylococcus aureus. It's a type of staph infection that is resistant to methicillin, which is an antibiotic, similar to penicillin. So this is a tough superbug that once you acquire it, it can be tough to get rid of because it's resistant to some medications. So I've got a special guest tonight. Her name's Portia Milby. She's a nurse over at Bellarmine Hospital. She's going to take us kind of on the path, telling us a little bit about MRSA and what we can do to prevent that. Portia, how are you tonight?
I'm good. Thank you, Ryan, for asking,
Good.
and I'm glad you have me here tonight to discuss MRSA. It is a huge hot topic among the healthcare community.
It is.
Yes, MRSA, most people within the community develop MRSA due to non-adherence to their antibiotics.
Okay.
So these patients are prescribed an antibiotic such as penicillin, and they start taking it, and after a few days start to feel better, and then they just stop taking it. And therefore, the microorganism, it's still present within their body, and it starts to evolve to develop resistance to penicillin, which is the number one antibiotic prescribed to treat bacterial infections.
Oh, wow.
Yeah,
Okay.
so that's a huge problem. Now, within the hospital, patients are acquiring MRSA by contaminated healthcare workers and contaminated surfaces. So it is just, it can't be stressed enough that hand hygiene needs to be diligently done before and after entering a patient's room.
So we're looking for clean surfaces and clean hands. Is that right?
That's right.
Okay. Now, somebody with MRSA, what would that look like on a patient like that?
Now, a patient with MRSA would probably, they would exhibit a fever. There would be edema, swelling, which is edema, and redness and inflammation at the site of entrance of the microorganism into the body.
Okay.
And then also that site would resemble a pimple or a spider bite, which quickly develops into a deep, painful abscess.
Oh, wow.
Yes.
Okay. So what else can we do aside from hand hygiene? I mean, what other things needs to be done in the hospital to prevent an infection like this?
Well, first, the infection needs to be identified. So we would take a culture and sensitivity. The problem with that is it takes 3 days to get back.
Okay.
So once we have the microorganism identified as MRSA, then the patient needs to be put into isolation precautions.
Okay.
Which is thus the outfit that
This
you
outfit.
are wearing right now.
Yes, I am. Yeah.
So a patient within isolation precautions, it is recommended that both the family and all healthcare workers providing for the patient be wearing a gown.
Okay, a gown.
Gloves.
And
a surgical mask.
a surgical mask. Yes.
Whenever they're inside the room with the patient.
Okay. And now this is to protect me from the patient, or the patient from me, or both?
It's definitely to protect you and the visitors from the patient.
Okay.
And people out in the community once you leave the patient's room and you're out in the community and you have acquired this MRSA infection that you don't know that you have. So we're trying to prevent the spread of it.
Sounds like a bad deal. Nobody wants MRSA, huh?
No, not at all.
Okay. Gotcha. Okay. Well, very good.
Yeah, so I mean, definitely we would want to stress the hand hygiene, diligent wearing of the personal protective equipment, and then also completing your antibiotic prescription once you do have that prescribed to you.
Okay, so take your drugs.
That's right.
Okay.
Complete them.
The whole thing.
Whole thing.
All right. Portia, thank you so much for coming with us. We sure do appreciate it.
No problem, Ryan. You all have a good night.
Yes, thank you, folks. Have a lovely evening.